When it comes to healthcare costs, everyone knows that hospitals are an expensive piece of the overall pie in America and Montana. But a recent national study of prices paid by privately insured patients shows that Montana hospitals are even more expensive than the norm. MTN's Mike Dennison takes a closer look at that study.
The RAND Corporation examined what privately insured patients pay at hospitals in 25 states, using data from employers paying the bills from 2015 through 2017. On average, these patients paid 2.4 times what Medicare pays, and in Montana it was 2.77 times Medicare, the fifth highest among the states studied. We asked Montana hospitals if this markup means these patients are being overcharged.
The data just don't support the allegation. We essentially are within 2% higher, low, above break even. So that tells me that you're not gouging patients. If you had collections that were far and above your costs, you could make the argument that the charges are too high, what they're collecting is too high, that patients are paying too much.
But if the hospitals are just covering costs, is their major expense, personnel, too high? Olson doesn't believe so, saying Montana hospitals pay 83 to 85% of the national average for skilled personnel. So we asked the state's largest health insurer, Blue Cross and Blue Shield, why it doesn't negotiate a lower multiple of Medicare charges. Spokesman John Doran wouldn't answer that question directly. Instead, he talked about Blue Cross's ongoing effort to implement something called value-based pricing.
We're fundamentally changing that to re-engage people in a primary care setting, which is a much more cost-effective model than going to the emergency room. So it's not about limiting healthcare services, it's about finding the appropriate care at the right time, in the right place, and for the right price.
Under value-based pricing, Blue Cross pays a capped amount for certain services for a set of patients, and the provider must keep costs under that cap. Doran says this approach saved $400 a year for each of the 100,000 Blue Cross customers it covers. But an author of the RAND study calls value-based pricing a distraction from the easier solution, insurers directing customers to lower-priced hospitals or just paying less. At the last Montana legislature, Democratic State Representative Tom Woods of Bozeman proposed a bill meant to limit payments to hospitals by private payers to 250% of Medicare.
We're not talking about bankrupting hospitals. We're not talking about controlling their prices. What we're talking about is trying to get them to stop screwing us.
Hospitals lobbied against the bill and it died on the House floor, with an equal number of Democrats and Republicans voting against it. Montana hospitals have generally fought attempts to regulate their pricing practices, but insist they're serious about controlling costs and say they're trying to encourage people to lead healthier lives and use fewer costly services.
The hospitals aren't deaf to the struggles for healthcare costs or for access. I think that the hospitals are doing their part to make sure that where they can economize or where they can cut costs, they're doing that.
As you can see, solving the high cost of hospitals and healthcare is a complex question. But the study said essentially the solution should be simple. Someone must demand lower prices if we have any hope to control costs. Reporting from Helena, Mike Dennison, MTN News.
Well, the RAND Corporation study says it was one of the first of its kind to examine hospital pricing.